Today's topic of discussion is agranulocytosis. Agranulocytosis is also known as neutropenia or granulocytopenia, in which decrease in neutrophil count below 100 microliter of blood. So, agranulocytosis have another name neutropenia or granulocytopenia. Here, neutrophil count decrease. What are the causes? First one is sudden infection like enteric fever, brucellosis, influenza, measles, viral hepatitis, malaria, kala asar. These are the infection will decrease neutrophil count. First one is sudden infection. Second one is overwhelming bacterial infection. Here, military tuberculosis and septicemia. Second important cause overwhelming bacterial infection, military tuberculosis and septicemia. Third things drugs, chemical, physical agent. In this one anti-metabolites and nitrogen mustards, benzene and ionizing radiation. Chemical drugs and physical agent. In this one anti-metabolites, nitrogen mustards, benzene and ionizing radiation. Fourth condition hematological condition. In this pernicious anemia and aplastic anemia. Pernicious anemia and aplastic anemia condition will decrease neutrophil count. Other diseases, cirrhosis of liver with splenomegaly, SLE and Coucher disease. So other disease, cirrhosis of liver with splenomegaly, then SLE and Coucher diseases also decrease neutrophil count. Then cachexia and ability and anaphylactic shock, then rare hereditary diseases, genetic disease. Here cyclic neutropenia, primary splenic neutropenia, idiopathic benign neutropenia condition will happen. So what are the causes? What are the things will causes agranulocytosis? Infection, then overwhelming bacterial infection, drugs, hematological condition, other diseases, then cachexia, anaphylactic shock and inherited diseases. Then what are the symptoms it will cause? Fever, chills, faster heart rate and breathing, muscle weakness, fatigue, then sore throat, bleeding, then inflamed gums and low blood pressure. What are the treatment? Granulocytes colonies stimulating factor. So granulocytes colonies stimulating factors. This is the drugs to help body to provide neutrophil faster. What are the drugs we are using? Drugs such as bilcrastin, bilcrastin and linograstim. Bilcrastin, bilcrastin and linograstim. These are the drugs used to increase neutrophil count. Then immunosuppressant, prednisone, then bone marrow transplant if other treatment are not effective. So what are the treatment we are using? Granulocytes colony stimulating factors, drugs like bilcrastim, begcrastim and linograstim, immunosuppressant, prednisone, then bone marrow treatment. So in this video we discussed agranulocytosis. It have another name neutropenia. Here neutrophil count decreased. So what are the conditions? Causes sudden infection, then overwhelming bacterial infection, some drugs, chemical, physical agent, then hematological condition, pernicious anemia and aplastic anemia, other diseases, then cachexia, anaphylactic shock, then rare hereditary diseases. These are the symptoms. Then drugs and drugs. Thanks for watching.